Good morning, everyone. Yes, it's time for Medical Monday, and we have a special guest in the studio today with us. And why don't you tell everyone who you are?
Hi, I'm Amy Erickson. Thanks so much for having me here today. I am the Rehab Services Manager here at Park Rapids St. Joseph's Health Services. In my role, I oversee a fantastic team of physical therapists, occupational therapists, speech language pathologists, athletic trainer, and of course our dedicated cardiac rehab staff, which includes RNs and exercise physiologists.
So the month of February, of course, is being American Heart Month. Probably a good time to visit with you, right?
It is.
Yeah. So tell us a little bit about what American Heart Month is about and how we celebrate National Cardiac Rehab Week. Let's talk about it.
So February is American Heart Month. Typically the first Friday of the month, they also do a Women's Heart Health Day where it's called Wear Red Day. And then this week of February 9th through the 14th is National Cardiac Rehab Week.
Oh, wow. It's all about heightening the awareness. There's specific types of cardiac rehabilitation services that CHI St. Joseph's Health offers. Let's talk a little bit about that and how it helps our community stay healthy.
Yep. So who benefits from our program is people that have had heart events, procedures, issues, that kind of thing, like heart attacks, stents, angioplasties, CABGs or bypass surgeries, heart valve replacements or surgeries, heart transplants, that kind of thing.
We're talking about procedures that they had. Preventative, is there anything involved there?
We do some preventative. There's different phases of cardiac rehab. So phase 1 is when you're in the hospital. So if you have an event of some sort, they're going to get you up and start you exercising while you're in the hospital. Phase 2 is kind of what we do here, which is after your event, and it's done as an outpatient basis. Mm-hmm. You come in and we hook you up to our heart telemetry system. We monitor blood pressures, heart rates, heart rhythms, oxygen saturation, that kind of thing. And then phase 3, we also have here at St. Joe's, is a more independent program, mm-hmm. which is open to anybody that has a cardiac risk factor.
Depending upon the procedure that you had, it is going to be a different path you probably go down in that rehabilitations?
Yes and no. Anybody that's had an event or an issue acutely or recently, they're going to do that phase 2 part first. Mm-hmm. And then they're going to, where we come in and we hook you up to our heart monitor. We monitor that the entire time you're with us, exercising, that kind of thing. And then once you graduate from that, then we can do the more independent program of that phase 3 piece. Okay.
Could you share some key statistics and interesting facts? So, with it being American Heart Month, you hear a lot about heart conditions, but let's talk about that. What are some of the key statistics?
So every year, over 1 million Americans have a cardiac or coronary event and undergo a cardiac-related procedure. About 800,000 people in the United States have had a heart attack each year. Mm-hmm. Cardiac rehab is not only to help the person recover from their heart issue, but also to help prevent future complications. 18 to 20 million Americans have coronary artery disease, which is basically affecting 1 in 20 adults in the U.S.
Now, that's a scary statistic right there. And a lot of it goes to what we've talked about, obesity before on CHI Medical Monday. I think that's one of the characteristics that people know is for heart disease and stuff. But 1 in 20?
1 in 20.
Wow. So ding, ding, pay attention, right?
A little bit.
A little bit. So 1 in 20. So that's a very key statistic. So a lot of people or families have seen this then.
Absolutely. Coronary artery disease is still the number 1 leading factor of death in the U.S.
Mm-hmm. And at the same time, our life expectancy, we're doing better.
We are.
The treatment, the rehabilitation, knowing what to look for, and then getting that help. And then if you need a procedure, then getting the rehabilitation and getting back on the right track. And
correct.
That's critical.
Yep.
Yeah, wow.
Sometimes keeping in mind, too, that men and women have different cardiac symptoms. Is sometimes, men typically have that crushing mid-sternal or mid-chest pain, whereas women may not. So don't dispute or discard anything that you're feeling that's different.
Yeah, if you listen to your body. I said that with Scott Monham last month. I said, listen to your body and pay attention. And if something doesn't seem right, it's probably not right. Go in and figure it out. Get it checked on. What are some of the most common and significant risk factors of heart disease? So
we all have risk factors for heart disease. The 3 non-modifiable risk factors, just our lot in life, are family history, age, and gender. Mm-hmm. The modifiable, or things that we can change, treat, or modify, are smoking, cholesterol or high cholesterol, high blood pressure, diabetes, lack of a prescribed exercise program, obesity, and chronic stress.
And going back to the prescribed medicines and things like that, and having the treat. If you prescribe that medicine for that reason, take it. I mean, I know, guys, listen. I mean, some of us are stubborn, but if you're on that medicine and you need it, you need to take it.
Correct.
Yeah, and take it appropriately and at the right time. So, but a lot of risk factors there. You really have to pay attention, and activity and work and stress is probably not one of the. That's another factor everyone faces, right?
Yes.
It's just a tough time, but you see the life expectancy improving. It's because you can get that medical treatment and get on the right path.
Absolutely. And use those support systems that are in place.
Okay, let's talk about beyond medical intervention. What are some practical steps and lifestyle changes in individuals? We talked a little bit about some of them, of course, obesity and eating and all those things, but what can we do to improve it?
Yep. So following a prescribed exercise program at least 5 times a week for that 30 minutes per day. If you smoke, please try to stop smoking or that smoking cessation. Once again, controlling those cholesterol levels, blood pressure levels, diabetes, take those medications if you need to. That's how you treat, change, or modify those risk factors.
Mm-hmm. And you hear a lot about the diabetes side of it. That is really, you have to stay on top of that.
Absolutely.
Yeah, and it's definitely. Are there some common misconceptions about heart health and cardiac rehab that you'd like to clarify for our audience? I'm sure there's a lot of them.
I think the top kind of 2 that we hear are, I'm active. Why do I need to come in? Mm-hmm. What we say to that is keep in mind that staying active is fantastic, but it is not a prescribed exercise program. And it's not going to condition and strengthen your heart the same as an actual exercise program does. Mm-hmm. So yes, please stay active, but you also need to have an actual program that you're following for that exercise piece. I also think that we often hear are, I'm not feeling better yet, or I thought I would feel better than I do. People need to remember that you've had a significant procedure or event or issue with your heart that's pretty crucial to you staying alive. And you need to remember that your heart is a muscle. So just like if you injure your bicep muscle, that needs to be rehabbed and fixed to get it to its top condition. We need to do that for your heart as well.
Yeah, we're not here to scare everybody, but you start listening to these things, and it's just like, it really does matter. And especially if you have there's some hereditary reasons in your life or in your family, or that amount of stress or the smoking like you've talked about, those corrective actions are so important. And not here to scare everybody. We're just saying, ding, ding, pay attention, and listen to your body and make some of those corrective changes if you can. And it's so hard with today's diets and foods that are out there too. I mean, you hear so much about it, don't you?
Yes.
Yeah.
It's hard to make the healthy choices, but making some even, minor modifications, and remember everything in moderation. Those fruits, veggies, whole grains, lean meats, that kind of thing, and make minor changes to get to those lasting bigger changes.
And simple as walking exercise. Get out there, enjoy our great outdoors. For someone considering cardiac rehab, what can they expect from the program, and what does the journey typically look like from start to finish?
So the journey typically starts with, if you're having an event, it's going to start while you're at the hospital. Your provider is going to send us a referral, and then once we receive that referral from the provider or the facility, then we send it to our business office to make sure that we don't need any prior authorizations for insurance and that kind of thing. Mm-hmm. Once they get that, then they call us, let us know that we're ready to schedule them for an evaluation. Once we call you, then we set you up for that eval. We have you come in, we assess your health history, check vitals, provide some education. Then we create what we call an individualized treatment plan. And then that is sent to your physician for approval. Once we get that approval, then we call you back and get you scheduled to come in to exercise. 2 to 3 times a week, preferably.
That's what I was going to ask you. 2 or 3 times a week is probably in the earlier stages of it, and then maybe spreads out?
Yep. We like to start with that 2 to 3 times per week to kind of get you in that routine. And then we also will start a home exercise program design with you as well, based off of what you like to do, what your hobbies are, what goals you're trying to reach, that kind of thing.
Oh, okay. So, and this could go on for how many months?
We end the program when you're kind of comfortable with that home program and being out on your own. And then we also have that phase 3 program. So if people don't really want to be done with us, they can continue in that independent program. And then, it lasts typically between, weeks to a few months, depending upon, what you've had done, the procedures, the events, your heart health.
And probably the progress. You see the progress of the individuals. So you say, okay, you've graduated.
Correct.
Or, no, we got to have you back here. We got to get you in a better place.
Correct. Everybody has a plateau. And kind of when you reach that top plateau of where you're at, or you're comfortable with the goals that you're trying to do at home and you're comfortable with your home exercise program, then we kind of graduate you to that.
And I think some of the vitals and the things and the strength they're having, that that, and the breath and everything they're doing, and you can probably medically see that they're on the right space, or in the right on the right steps.
When they come in for that phase 2 program, we hook them up to the heart monitor every time they come in too, so we can kind of see what that heart rhythm is doing in addition to the vitals. So if there's something that's different or changing, or they're having symptoms of some sort, we're going to talk to their provider too.
Oh, well, that's interesting. Definitely. Who makes the multidisciplinary cardiac rehab team at CHI St. Joseph's? Talk a little bit about that.
Our program at St. Joseph's is staffed by RNs and exercise physiologists. However, we also work with our dietitians to kind of go over that heart healthy diet piece, low salt piece, if they're diabetic, getting those specifics for each person.
There's that word salt again, huh?
Yep. Pharmacy, if people have questions or concerns about their medications, why they take them, contraindications, that kind of thing. And then respiratory therapists as well, if there's any concerns with lung issues as well.
So my guess is when they're in the program and you're going through it, maybe they're on a medicine that, a little bit of this dose or that dose, and then they go through the process, the rehab process. And I'm guessing that's the importance of having, somebody that pharmaceutical. So if there's reductions and things like that they can make, is that a common practice that you see, or change in the medicines as they progress in the rehab?
Sometimes, yes. If you're making those modifications and losing some weight and that kind of thing, sometimes those medications need to be adjusted. Or if your blood pressure is not quite where we think it should be, maybe you need to take a little more. If you're losing weight and, getting some back on the right track, then maybe some of those medications can be decreased.
Yeah, so I was kind of thinking about that there's probably some adjustments as they go through the process, depending upon how the rehab's going, and a lot of the medicines you take are based on weight too. So
correct.
Yeah. Oh, that's cool. How does a patient typically get referred to the cardiac rehab? I think we've talked a little bit about it, and what's the process of enrolling in the program? I guess if they have a procedure and they're at the hospital, you've shared a little bit about, but let's touch on it again.
If you or a loved one has had a heart issue, event, procedure, whatever, typically the provider is going to let us know that, and they should send us a referral. If we don't, however, get that, or if you haven't heard from us in what you think is a reasonable amount of time, then please reach out to us. Sometimes people are flown down to the cities, and so it's harder to get those referrals up to us here if it's coming from a facility that's farther away.
Yeah, and the same would apply. I'm guessing if you move into the area and you've been on a program, how would they go about that?
Then they just need to call us.
Okay.
And say, I want to transfer if I was here or when I'm moving into the area. This is where I'd like to come. What do I need to do? We'll kind of walk you through the steps of what we need and get you in. Yeah,
because medical records will transfer and go through the process. Yep. And I'm guessing that a doctor would review where they're at. And then, of course, the rehab process, you could get into the program. But I'm guessing that's pretty common. Some
It is fairly common,
You know, that somebody would move into the area, or potentially that they're a snowbird, which, I mean, the smart ones are in Arizona right now, right?
Exactly.
Yeah, but anyways, you know, they that 6 month, they're here, they're gone, back and forth. I mean, so those programs probably change. So
yeah, we do have a fair amount of people that may either start with us and then go south for the winter and finish their program down there, or vice versa. You know, if they have something happen in February, March, and then they're coming back here in the spring, we can certainly take those transfers too.
Yeah, well, great program. So for those that who might be interested in cardiac rehab services and have questions about heart health, where do we start? I mean, sometimes that's the biggest thing. It's just overwhelming, and they don't know where to make that first step. Well, do it. One, make the first step. So what would you suggest?
First and foremost, they can call the main office at the hospital. They can transfer them down, but we do have a direct phone number, which is 218-616-3000. That is our direct line. If we don't answer, leave us a voicemail. We'll call you back if we need to get you started.
Excellent. So I think that's the thing is, don't wait. Make the call. I mean, it's just easy. Do the right thing and make the call. Get yourself on the right track. And of course, with February being American Heart Month, and as we've talked, you know, a lot of times people go in for a medical procedure and then they come out, and the next step is to get rehab and go through that process. But I'm guessing between the medical procedure and the rehab, there's a lot to cover and a lot of questions that probably arise. So take me through that process maybe a little bit better.
So in my opinion, cardiac rehab is absolutely crucial because you have the medical procedure, and then while that is very life-saving, it's only one piece of the puzzle. So imagine having a major heart surgery and you're left with a lot of questions, fear, and a body and a heart that now needs to heal and rebuild strength. Cardiac rehab provides that essential structured bridge from hospital to home. It's where our patients learn to safely exercise, how to manage their medications, choose better options to eat, and how to cope with that emotional impact of the heart event. Our cardiac program at St. Joseph's is tailored to each individual, but generally it involves several key components, usually spread out over several weeks or even a couple months. And the components include that medically supervised exercise piece, which is often what people think of when they hear of the cardiac rehab program, that they're exercising in that safe environment. We have treadmills, bikes, new steps, you know, a plethora of exercise equipment to use. They're placed on that heart telemetry system, and then their heart rhythms, heart rates, blood pressures, oxygen saturation are monitored from beginning until end every single time they come in. Education. We teach the patients about their specific heart conditions, how their medications work, the heart healthy diet, stress management techniques, and understanding their personal warning signs and symptoms that they should be watching for. And then, of course, that lifestyle modifications, and that includes the help with the smoking cessation if needed, weight management, and then incorporating the physical activity into your life. But I think just as importantly is that emotional support. A heart event can be very scary for the person and their family, and can lead to anxiety, depression, that kind of thing. And our team, along with being able to connect to other patients in the program and to other resources and sharing those stories with each other that may have had similar experiences, provides that emotional support and guidance that they may need down their journey. Yeah,
you know, when you look at that too, is it kind of sparks, you know, you've been through this medical event that is, like you said, quite strenuous, and now you have to come to rehab. You're still scared because it did happen. So having that supervised rehab component there where they're monitoring that and knowing how hard you can push yourself, the physical activity you can do, probably helps them transition very well, so they know too. I mean, because that's a medical event that scared you. I mean, most people. Now, how much can I do to exercise? What can I do in a supervised manner is critical, I would think.
Exactly. It's beneficial for both the patient that had the heart heart event and the family or spouse or significant other or children even.
Is there one key takeaway or overarching message you want to give the community to remember regarding their heart health, prevention, and importance of cardiac rehabilitation, established, of course, with it being the American Heart Month?
I don't know if there's just one key takeaway.
There's a lot of things in there.
Lot of things. Don't hesitate to contact your provider or call 911 if you're having chest pain, pressure, tightness, discomfort, increased shortness of breath, increased fatigue, anything that's different or unusual. Make sure you make that initial contact with your doc or provider, or 911 if you're at home and having issues. If something just feels off or weird, get it checked out.
Yeah, absolutely.
2, take those preventative measures sooner rather than later. Something is better than nothing. So start an exercise program, make those healthier choices. Just start monitoring, that salt intake once again.
Yeah.
Talk to your providers if there's something that you think is not quite right, because you're probably right. You are in charge of your own body and you know what's your normal versus not normal. And then just remember, we're here for you and your heart health.
Yeah, it is a very vital part of your body. You have to take care of it and you have to pay attention and listen to your body. Just because you did a bunch of lifting or did that it's just my shoulder that's causing this problem or whatever. If it doesn't feel right, ask the questions, rule it out, make it an orthopedic problem instead of a cardiac problem. Rule it out. And make sure that you're doing the right stuff.
Absolutely.
Yeah. So again, how's the best way to get connected with Rehab if we need it?
Call St. Joe's, that main telephone number. They can transfer us down, or our direct number in cardiac rehab is that 218-616-3000.
Well, excellent. Amy Erickson, Director of Rehab Services at CHI, St. Joseph's Health. Thank you so much for coming in. Wasn't that easy?
Thanks for having me.
Yeah, you're very, very welcome, and take care of yourself.
Thank you.